Hello, everyone. Rebecca Snow here. I am a nutritionist, herbalist, CNS supervisor, mentor, and owner of the Nutrition Herbal Collective. So today we're talking about in-office testing. Let me change my screen share here. Yeah, so I titled this talk, but I think I want to change the title to no cost testing because some of the examples I'm going to give you actually are at-home tests and not tests that you would do in the office. But these are tests that we often talk about at the Nutrition Herbal Collective and a lot of nutritionists use. And let's just face it, there are some states you can't order testing. A lot of clients can't afford functional testing. Some testing's not covered by insurance. So we need to have options for collecting data. So why are we talking about this? Lab testing is expensive. I think a Dutch complete, could cost the client $400. And that's, potentially the same cost as 2, 3, or 4 or 1 consult with a nutritionist. I mean, that could be, half of a rental payment for the month. So lab testing is expensive. We need to keep that in context. We love getting lab data. It's so awesome. And, we want to have other options. So CNSs can't order lab testing in some states, in some red states, New York, where, in states where CNSs can't get licensed. So we need to have other strategies to work with. So let's just talk about a few workarounds. Number one, you can partner with the medical team for your client. At the Nutrition Herbal Collective in our mentorship program, we share a lab request slip that you could use as a template for requesting labs. We have another video on the Resource Hub, how to collaborate with doctors. So if you're new to that, you can check that out. Also, we want to use other assessment tools. We don't want to rely too heavily on lab testing because we're going to have clinical situations where we just don't get it. A client doesn't have medical coverage. They can't afford to go see a doctor and get lab testing. If we look at medical history, like medicine used to be practiced very like bedside, high touch, conversational, history taking, differential diagnosis with clinical symptoms. And medicine has now evolved to be highly, reliant on data, quantitative data from laboratory assessment. And laboratory assessment is an amazing tool, but we do want to keep it in the context of clinical nutrition. So there's a parallel with nutrition that, 25 years ago, we didn't have some of the tests that we have today. So we relied on good history taking, nutrition-focused physical exam, dietary analysis, diving into signs and symptoms. There's a great video on our Resource Hub, like how do we analyze symptoms and what information can we get from symptoms? Because one of the things that can happen sometimes is a client says, my Lyme disease is acting up. I don't know about you, but I never learned about Lyme disease in my anatomy and physiology class, that Lyme disease doesn't exist as a phenomenon. It's a story. It's a story that sometimes we use or a client uses to describe certain phenomenological information that they're gathering through their experience. So we want to dig in with clients, do good history taking, ask about signs, symptoms that are showing up for people and what that looks like. And practice our nutrition-focused physical exam, which gives us a lot of information. So and this is kind of an aside note for this talk, but the reason we need in-office at-home testing that is free or low cost is because sometimes labs just aren't available to us. So in the context of that, what are some other tools we can use? And then of course there's direct to consumer testing, DTC, direct to consumer testing. That's kind of like a whole nother topic. I'm not going to go into that much today, but that's another avenue for getting lab work done. Okay, all that being said, the other workaround is what we're going to talk about, which is what are some tests that we can run in the office or at home to gather information. Now, most of the examples I'm giving you are not validated. There is evidence that they're beneficial. They give us information, but we have to take the information we get from these tests with a little bit of a grain of salt. Like it's one piece of information. My hair is going crazy in the wind right now, and that's great, but it's not. We can't take it as hard fact. We have to kind of balance it out, and that's true with any assessment. We get a high arabinose on an oat test that indicates candida. We do need to balance that with the clinical picture as well. Okay, so skin patch iodine testing. A lot of these ones I'm giving, they're a little controversial. This is definitely not a validated test, but even some endocrinologists use it because when the body is deficient or insufficient in iodine, we will absorb iodine very quickly through the skin. Now, it's not as definitive as a serum test or a 24-hour urine test, but it is helpful and it can be done in the office. Basically, you want an iodine solution, a yellowish brown iodine solution, and you're going to paint a patch on an area of the body that doesn't rub against fabric or come in contact with much. So usually like the inside of the arm is helpful. And you don't want to bathe or shower, for 24 hours. And basically you're watching it for 24 hours and seeing how quickly does it fade. Now, we don't have like, again, this is going to be based on your observational data. So we're observing the color and the speed with which the patch fades. And you're just making a clinical judgment call about that. So again, this is not like where the lab gives you a measure and says below 30 is deficient. You see they're below 30 and then you decide they're deficient. This is using observational data to get some evidence about what's going on for that person. But if the patch is a pretty robust color in 24 hours, that gives you some good information that they probably are sufficient in iodine. But if it does fade quickly and or significantly, there could be an increased need. And what are some other things you would find out about? You would ask what iodine sources they're eating. You might find out about other halogen exposure to, iodine displacers. So yeah, that's a good one. I keep some iodine in my office. Now, what if you're doing 100% virtual? You can tell your client to go buy some iodine and tell them how to do the test at home, show it to you, take pictures. So you can do these tests virtually as well. The peanut butter test. This is an interesting one. So researchers are finding that in early dementia, it's very, very common. High percentage of people with early Alzheimer's have a discrepancy between the left and right nostril and their ability to smell. And peanut butter actually acts as a good medium for this test. Now, in folks with mild cognitive impairment without dementia, the incidence of the left to right nostril discrepancy on smell, the smell test, is closer to like 40%. So it could also be used in mild cognitive impairment. But this would be a great in-office test if somebody's concerned, they might have dementia, maybe they need a referral out for a neuropsych eval, is doing the peanut butter test. So basically how to do it, the patient is going to close their eyes and you're going to put a tablespoon of peanut butter in a little bowl, and the patient's going to close their eyes and close one nostril with their finger, and you're going to note which nostril's open. And the clinician's going to put a ruler from the nose down with peanut butter there. And the patient's just going to breathe normally. And you want to start, I would start definitely 20 centimeters down. And basically every time the patient breathes out, you're going to move the peanut butter up in a segment of about a centimeter. So you're going to do that. And then you record the distance and take a break for 90 seconds and then repeat on the other side and record the difference. And what the researchers are finding is that sometimes there's up to a 10 centimeter difference between the nostrils, the left side being that the patient requires the peanut butter to be closer to the left nostril to smell it versus the right. Now, obviously, there's other factors that could play a role here, such as a deviated septum, one-sided nasal congestion. But this is a good in-office test. Again, qualitative, observational, gathering data. The baking soda test is a really common one. Why do we do this? It tells us a bit about people's stomach acid levels. Is knowing their stomach acid levels like the answer to all their gut problems? No, it's one piece of information. There are many factors that affect reflux, dyspepsia, indigestion, IBS, but stomach acid levels is a factor. So this is a good at-home test. And essentially, you're having your client mix a 1/4 teaspoon of baking soda in 4 ounces of water. First thing in the morning before they eat or drink, and they drink that solution. Don't guzzle it because, you know, when you swallow air, you're going to burp. And then you count the seconds/minutes till you burp. You can definitely stop counting after 30 minutes. But if there's low stomach acid, it will take longer to burp, 5 minutes plus. You know, and again, this is like, it's scalable. So if somebody never burps, that's, you know, more of a problem than somebody who burps at 10 minutes. And if there's high stomach acid, somebody might burp very quickly within seconds or a minute. I recommend clients do it 2 days in a row or even 3 days in a row just to gather more data to see if there's a consistency day to day. Okay, so that's the baking soda test. Why is it helpful to know stomach acid levels? Because a lot of the interventions we use for the upper GI have an effect on stomach acid. Some can lower stomach acid, some can increase it. So, you know, like apple cider vinegar, betaine HCl tends to increase stomach acid, whereas, you know, something like neutralizing cordial or meadow sweet might be more appropriate for somebody with high stomach acid levels. Okay, so urine test strips. You can have your client urinate in a little pee cup and use a urinalysis strip. And this actually gives us some good information, particularly if a client, you know, is not in the medical system, they don't have access to medical care, but maybe they need to go to a free clinic or they need some medical assistance. You know, you're going to pick up on things like protein spilling over in the urine, glucose, blood in the urine, could be an acute urinary issue. I mean, you do want to check if somebody's, you know, on their menstrual cycle, because that would definitely increase blood in the urine. But one of the most useful markers here, other than ketones, which would tell you if somebody's in ketosis. So this would be a useful test if somebody came in saying they're eating a ketogenic diet, but, you know, they're also eating Twinkies and they're convinced they're in ketosis. This would be a good way to demonstrate that they're probably not in ketosis and kind of educate about the ketogenic diet. What are the benefits? It definitely doesn't benefit someone to eat gobs of high fat foods and not be in ketosis, particularly if they're high saturated fat, omega-6, etc. So that's one bit of data that's super useful using one of these urine test strips. Another thing that's useful is the pH, urinary pH, because, you know, the urinary pH will tell you if somebody it reflects the alkalinity or acidity of the diet. So if also if somebody's prone to kidney stones, you don't want their pH to be highly acidic, like below 5.5. That increases the precipitation of oxalates in the urine. So, getting that pH more alkaline would be beneficial to that client. So knowing urinary pH, that could be helpful for kidney disorders, for bone disorders. And there's more data you can collect here, but those are some of the highlights for nutritional interventions. Stool transit time. This is a good at-home test. Basically, have your client eat half a raw beet. You can grate it on a salad. You can slice it up and dip it in hummus. But basically, they're going to eat that and then watch their poo for purple reddish color. Usually when you eat beets, the reddishness kind of dissolves into the water, or you might see it in the stool. But usually there's a tint to the water. And basically you're just watching your poo, or the client's watching their poo, to see when they see the telltale signs that the beet has come out the other end. And then you count the number of hours since you ate the beet. So you have the client note the time they ate the beet and note the first time they see that color show up in the toilet. And you don't want them to eat beets again after that first one until they see it, Ideal transit time is 18 to 24 hours. This is a good at-home test to see if somebody has slow transit time. And last but not least, the zinc tally test. So evidence suggests that when we are deficient in zinc, we do not taste it as well. Now, somebody could have loss of taste for other reasons as well. And there are actually bitter taste strips you can buy for a nutrition-focused physical exam to see if somebody is a super taster, they can really taste bitter, or they don't taste it. So if you're doing a zinc tally, you might also want to have the bitter taste strips to analyze a client's ability to taste, because there's a lot of information that gives you about the client. But for the zinc tally, again, take it with a grain of salt, because there could be other issues affecting ability to taste. But essentially what you're doing is holding the zinc liquid in the mouth for at least 10 seconds. I usually do 30, 10 milliliters, which is 2 teaspoons. And then after you do the test, the client can swallow. You are asking them to, like, when the zinc is in their mouth, they could just shake their head if they taste it, or shake their head no if they don't taste it. So you can find out how quickly they taste it. Some people taste it right away. Some people don't taste it at all. But essentially, if there's no lack of taste or really delayed taste of zinc, they may have a zinc insufficiency. And what does zinc taste like? I mean, I think it tastes like a penny, like if you were sucking on a penny or a dime or some metal, that's what it would taste. That's what it tastes like to me. Okay, so those are some at-home testing methods and in-office testing methods that you can use. If you like this video, give me a thumbs up. Check out our resource hub, the Nutrition Herbal Collective. We are taking enrollment right now for our CNS test prep course, and we have a full intake for September. But if you're interested in our mentorship program, you can apply for November or January. And again, this is Rebecca Snow. Looking forward to connecting with you soon. Take care. Bye.